Next panel, last but not least, a fascinating conversation that we will have around resilient health systems, also at the nexus of pandemics, conflict, and climate. So I would like to invite here Sprig Gomb, our Senior Fellow for Health at the Ibrahim Foundation, to lead that conversation.
Thank you very much. Is my mic? Yeah, my mic is on. I am standing between you and lunch, and I've also been instructed I have 15 minutes less than we would have liked. So, without further ado, I would really like to invite our distinguished panelists to come and join me. I will say now, all protocols observed, so that we don't take up a lot of time with introductions. You know them all. Dr. Jean Kaseya is a familiar face on the global health scene. Dr. Marta Temido, who is a member of the European Parliament and former European Portuguese Minister of Health. And Mr. Dirk Brems, who is the Director for Multilateral and Thematic Cooperation at the Belgian Ministry of Foreign Affairs and Development Cooperation. Please join me. As they are saying hello and taking their seats, I would like to do two things. The first is to insert something into the title of our discussion. So when we're talking about health, I'm going to recontextualize this in SDG 3, which is about health and well-being. And in extending that discussion, we have heard and we have been encouraged to talk about the nexus of the issues that we are speaking about. And so what is the nexus of health and well-being between Africa and Europe? On Monday, the final round, we hope, of the negotiations on the pandemic treaty begun in Geneva. In that negotiation, a number of issues are contested, including between Europe and Africa. That is on commitments on investments for health. That is of sharing of access and benefits that result from the pandemic treaty. And there are contestations about how One Health should be applied in the context of the pandemic treaty. In addition, we have a G20 Health Ministers Declaration just concluded that is very ambitious on some fronts and implicates both now the African Union and the European Union, as well as the member states. A South African presidency of that union, of that G20 that is ahead of us, the troika of which will include the United States of America, which is the next G20 presidency after South Africa. We have the reality of the climate crisis experienced very tragically and painfully in Spain, and we send our commiserations to the people of Spain for the losses that they are enduring in a year of superlatives of the pandemic crisis. We have an unspoken and perhaps unconsidered lasting trauma from the pandemic, from climate crisis, from people who are orphaned. 1 in 5 children in Africa is an orphan. What does that mean for long-view leadership? We have an epidemic of loneliness identified by the UN, I think experienced particularly in an aging Europe. And that epidemic of loneliness may or may not be fueling a culture of fear and mistrust of the unknown and of the foreign. And against all of that, we have to find a way to forge partnerships, and as President Robinson has exhorted us to do, take a long view. So my first question to each of you as panelists, and perhaps I will start with you, Dr. Kaseya. What do you see as long view leadership in the context of health and well-being at the nexus of Africa and Europe? And you can also answer that in turn.
Thank you so much, and thank you for inviting me. Yesterday, I was speaking with some leaders, EU leaders were attending this dinner that we had, and I said I decided to cancel all trips out of Africa to focus on the outbreaks that we have in Africa. I made it that as an exception. I knew that I would meet Mary Robinson, Mo Ibrahim, and other leaders, because I wanted to engage them on this dialogue. When we talk about the nexus between pandemic, climate change, and conflict, we need to see that, as you said, how can we strengthen the relationship between European Union and African Union to move forward? We need to know that the next pandemic we are talking about can be next door. Today, we are facing Mpox in Africa. We are facing Marburg in Africa. But these two diseases are classified by WHO as being potentially pandemics. If we don't address that, if we don't control these outbreaks, all of us, we are at risk. Let me share something with you. We are talking about mistrust between Africa and Europe. Mostly when we are talking about mistrust, we talk about COVID. But some people, they even don't know that when COVID was public health emergency of international concern, we had also another disease that was at the same time public emergency of international concern. It was Mpox. What Europe and the US, they did, but let me talk mostly about Europe. This Mpox, we have only 5 deaths in Africa, in Europe, a number of cases, but 5 deaths. Europe, they manufactured vaccines quickly. They manufactured diagnostics, medicines. They vaccinated their own people. They didn't see that in Africa, this Mpox was growing. Number of cases was growing. And you know what they did with the remaining doses of vaccines? They decided to keep it as stockpile for themselves. Africa didn't receive even one single dose of vaccine. At the same moment, and this is what is linking the nexus we are talking about, at the same moment, in the eastern part of DRC, and when we are talking about eastern part of DRC, you have to understand that I'm talking about 4 countries: Uganda, Rwanda, Burundi, and DRC. At the same time, we have a mutation of this virus that created the clade 1b. This clade 1b is what is killing mostly people today in Africa. And this clade 1b was discovered before even lifting the status of public health emergency of international concern of Mpox. It means it was there before lifting the status, and we didn't get solidarity. This is what is making me, as Director General of Africa CDC, a little bit uncomfortable, even to sit and to talk about this issue with some of our partners. Because I say this is lack of solidarity. And now, let me inform you, Mpox already killed 1,100 people in Africa. Mpox, when I started to talk about it in April 2024, we had only 6 countries. Today we have 19 countries. Mm-hmm. How many countries do we need for our partners to come and to support? Europe, they are telling us, Africa, you are not organized. But Africa CDC is there. Today, Africa CDC is leading health in Africa. We are putting all ministers together. We are putting all head of state together. If you see my post, almost every week I'm meeting all African head of states, everywhere I'm going. Today, we decided to create for the first time one continental response plan with one mechanism to lead the response. And how much did we get from Europe? How much? And I can tell you, when I flew, I was in CNN, I met some dignitaries from the US. They committed $500 million as pledge. How much of this pledge is now? We can say we get money from this pledge. I think this mistrust, I can see it on daily basis. This is why my leaders said, DJ, will organize a meeting, will increase our domestic resources. But we have to say to our partners, mostly to Europe, they don't have to abandon us. If they abandon us, it won't send the message that we are looking, now we are looking to build a strong relationship. I will finish by saying, we don't want every day when we have an outbreak, as we did for COVID, as we are doing for Marburg, as we are doing for Mpox, to start to beg for European countries to give us vaccines, medicines, and diagnostics. We need to manufacture our own vaccines, our own medicines. My big brother was talking about manufacturing. We decided to launch a big initiative in Africa called PAVM, Partnership for African Vaccine Manufacturing. Now we are extending that to other commodities. Then they were telling me, you don't have market. We said, okay. We went back. We created the African Pool Procurement Mechanism. What was the reaction? People decided to say, why did you create that? You will break the mechanism that exists globally. Do we think about the mechanism at global level? We want to give access to our people to medicines, diagnostics, and vaccines that they want at affordable price and quality product. I think this is where we are in Africa. We are very serious with this agenda. And we are just asking Europe to send us strong and tangible messages that can show us that we are moving. I will stop there.
Thank you. Perhaps I could come to you, Mr. Brems. I know that Belgium has taken a particular approach in Senegal. Perhaps you can speak about that, and then more broadly about long-view leadership for health and well-being.
Okay. When I was listening to you, I was thinking, what should I do? Should I say what I had prepared, and I'm not going to do this? Or should I react on this, or should I react on the whole of this conference? Because in each session we had things we could link in practice to health, and what is the reaction of the international community in a practical case. I was going to answer to the Ugandan man who was there saying, yes, it is the local delivery which is important, and we talk a lot and we have a lot to say and we can still discuss, but in the end we have to go back. And in the end, it will be the government having to deal with the service delivery for their population. That is a fact. We cannot outsource everything to private sector because the state has to do its own part also. And this has to do with domestic resource mobilization. This has to do with linking the population with the leaders they have a right and they are entitled to. This is what was written, for instance, in Gambling on Development of Stefan Derkon, who is saying that development is increasing when there is the good leadership. So this is something we should look at. This is linked to the illicit flows. This is linked to a lot of issues. So this was what I was going to say first. And then I hear this and I say, well, do I have to defend Belgium? Do I have to defend Europe, what we did? We are there. We are the ones now, Europe with Belgium, we are the ones pushing the international community to do something. We are planting the seed money, but it's not enough, that's for sure. If we look at what is the need, 15 million vaccines for Mpox. We all know it costs 120 euro a dose. If you multiply it by 15 million, you know the cost. Where is this money going to come from? We were talking about getting new finance modalities, getting the international community behind the investment. Is this an investment? Yes, of course it's an investment. No one is safe until everyone is safe, and all these slogans we have put forward in all these international discussions, etc. So we have to see it, the whole system through, and look at every part, and that's where we are really going for these mutual beneficial partnerships. We have to have a partnership where Europe and Africa together are moving forward and are gaining from this partnership. And we need more efficiency in aid delivery. We need more efficiency in national management, etc., etc. So yes, of course, there are a lot of challenges, and we can tackle them together. It's not by saying you don't do enough. We are all doing a bit, and we're not doing enough. that's clear and I accept it. So let's see where we can move forward and where we can go in Senegal.
Okay. In Senegal, for example.
That's where we come to. We have started with Belgium during our presidency, and we are building on this. We have started to produce, to try to start the production of vaccines and health products in Africa. And we are working in Senegal to put it together and to try to move forward. We have identified other countries where we can do it. We are working with South Africa. We are working with Rwanda. And it's all done in a Team Europe spirit, where Annabelle, which is also represented here, is taking a leading role together with African CDC. And I want to stress it, under the lead of African CDC. Whatever we're doing now, distributing vaccines in Congo for the Mpox, we are doing it under the coordination of African CDC. And that's perhaps small steps, but it are important steps to go towards this partnership. And perhaps I should stop here.
Just so we can also hear from Dr. Temido, and I want to hear from you in the audience as well. So go ahead.
Hello, thank you so much. Thank you for the invitation. I think that clearly we are not doing enough in the European Union. And I would like to take a step back first and say something, because you asked us about leadership and about the vision. And I think that the leadership we need is one that stresses the need, the basic need of more resilient healthcare systems. And this seems quite simple, but it is not. But it is true that now even the concept of pandemics, and we are talking about pandemics, includes the resilience of healthcare system, because the concept that the WHO, Intergovernmental Negotiation Body, refers recently recently put on the table includes the pressure of a pandemic on the healthcare systems and recognizes the need for more resilient health systems. So I think that we need to come to that, and we need to think that this encompasses universal health coverage. And that is not only providing vaccines or medicines or whatever. I would say that the big difference between one of the big differences between the answer that European countries can do to Mpox and one that African countries can present to Mpox also is related with healthcare systems, because vaccines or medicines is the easiest part to do, but we need to go further. And for that, we need to develop true partnerships based on equal parts. Of course, that we need to address all issues that were have been mentioned before, namely the questions of the financial international architecture, the questions of financing, the questions of international debt, etc. But we need to move in the direction of learning from each other. I would like to mention an example of that. A book, a very well-known book of Nigel Crisp, Turning the World Upside Down, was about the way healthier countries can learn from low and middle income countries. A new version of that book is how all countries can learn from their more fragile communities to develop innovative solutions for healthcare problems. And again, this is much more complicated, I think, that just delivering vaccines or deciding about patent issues. And I fully agree with the director of CDC Africa point that we need to accept that those countries need to have their autonomy in developing their products. But I think that the vision, it's much more than that, and it's about health systems based on primary health care for everybody, because it's the only solution that is sustainable.
Okay, so investment in primary health care is what we need to see. We need to see universal health coverage provided. That all requires money. That money does not appear to be forthcoming. At the same time, we are looking at a year, next year, in which the African Union will be calling for reparations as a way of leveraging new resources. There will be questions about refinancing, and financing for health will be central to those. We will be looking at a European Union that's vastly reduced overseas development assistance. So I see developments in real life that do not match this very nice rhetoric, when all of us who are very smart in this room know that we're not going to achieve any of the things that we wish for resilient health systems without putting the money on the table. And I recall from the COVID pandemic, and we'll try to look at the leadership, that Africa came with money and was still told, get to the back of the queue. And this is the basis of some of the mistrust that we see in the room. So very openly in this room, can we have a discussion about what it takes for you, Europe, to move, and what it takes for you, Africa, to move, and not letting Africa off the hook? There is another kind of mistrust, and that is that resources that accrue to our governments do not necessarily accrue to our societies. So how do we address that other elephant in the room? I will take comments and questions from the floor, and you can think about your responses. Yes. I don't know in which order the hands went up. Maybe over there, and then Eloise, and then we'll go to the back.
Yes,
Introduce yourself.
So my name is Dirk Brems from the Training for Health Equity Network. I'd love to hear people's perspective also, the key ingredients of a resilient health system: health workers, migration of health workers, investment in health workers. You know, a lot of African countries train them and pay for the training, and many of them then move back and forth. Any ideas on how to address that challenge?
Okay, we'll take all four questions before we go ahead. Eloise, your question or comment. Over here, please, the mic.
Hi, I'm Eloise Todd from the Pandemic Action Network. I just wanted to thank Dr. Kaseya for his straightforward comments, and I think it is highly frustrating for many of us advocates in Europe and elsewhere to hear the grand rhetoric about the partnerships that we want to create with respectful partnerships overseas. And yet there isn't enough understanding about the damage done to the political relationships through the COVID years, and indeed the aftermath now, and even seeing this in action around Mpox and Marburg. And I think one of the difficulties we have, we tend to technocratize health interventions or ODA, these like soft issues that are not soft at all. It's about investment in manufacturing, R&D, delivery, supply chains, people's lives, people's livelihoods. So until and unless the European Union, its member states, and frankly lots of partners understand the politics of what's happened during COVID, not just the, oh, it's a bit of money, can we afford to give it? No, the distrust is real, and it's because of real actions that were undertaken or ignored. So I think we need a bit of that matching. It's what you said, Spring, just now. But when we're talking about, oh, what do we think about ODA, the partnerships, the future? Well, there's types of money, we can debate it, but what we know from the current multi-annual financial framework of the EU is the money for partnerships was pilfered and pillaged time and time again because of urgent crises on the continent, because of Ukraine, because of Gaza, because of economic crises, but it was taken from partnership money that needed to go elsewhere as well. So let's get real in the next long-term EU budget. Let's have way more for EU external action, because it's not about charity, it's good politics and it's good policy. So I'll leave you with that. Thank you for your remarks.
Go ahead. Everyone's questions have to be short because we have very limited time.
Yes, again, Ibrahim Forum, the chairman of Ugandan Feeds Manufacturers Association. I don't know if there's anyone here from African Union.
I'm from Africa.
Yes, so no, it's a good point. Yeah, we are going together. As we're talking now, last year in July, I was in Naivasha in Kenya with the African Union and the Bill Melinda Gates Foundation. We're working on the 3 Cs: COVID crisis, the Ukraine, the conflicts, and the climate change. Now, the truth is Africa is the hot girl. You know, she's the person who everyone wants to work with because she has a good future ahead. We're talking about the young population. However, Europe, for so many years that it's been in Africa, is not recognizing what Africa's potential is and beyond. But the more European unions continually, as the lady just said, bureaucracy, all these type of meetings we have, we're losing the momentum. And other international organizations like the Bill and Melinda Gates Foundation are putting in investments to see that they can work with Africa. So again, I go back to the very point I said earlier on. We've been talking, and it's really great work that Brems and your team in Belgium are doing to help in advancements and really being on ground, but Europe needs to act. We have had so many lengthy information. We have enough data about Africa, and it's great that some of the people who are around here, they know what Africa needs, and they've been working with these good methodologies. Now we're talking about paradigm shift, but we really need action now, less than continuous conversations. That's what I believe.
Thank you for your comment. Was there another question or comment? I saw one more, or otherwise we come back to you. Let's start. Who wants to go first? I will give you freedom of the
Sorry.
mic. Okay.
There is a question there.
There was actually an
There's one more question?
Do
Okay.
I have the time, or do you want to go ahead?
Go.
Okay,
Yeah.
Margherita Leone from Save the Children. Well, first of all, I would like to thank Marta Temido for the mention of investing on primary health care. Without primary health care, we are not going to achieve universal health coverage. We know that by 2030, this is already a very majestic objective that very likely we are going to miss. And the funding discussion is absolutely necessary. 2 comments. The first one, one
Go
comment
quick.
and a half.
Okay.
The first one, when we talk about mistrust, can we talk also about the elephant in the room and IP waivers?
Okay.
Because we can continue this discussion, we can increase the manufacturing, we can increase the capacities from the African continent. What do we do if we do not have, for the next pandemic, IP waiver, first of all? Second of all, we have an European framework on global health. This is the European Global Health Strategy. This has not been embedded by all European member states. This is not reflected in the strategy of the Global Gateway. And the Global Gateway, it's mainly focused on infrastructure. There has been the publishing of a report just last week from Oxfam denouncing who actually benefit from the Global Gateway. And these are not civil society organizations, these are not African partners. So I think that at a certain point, we also need to be a little bit realistic and look at the next MFF for the actual possibilities that it will unlock. Yes, it can unlock funding, but if we do not build equal partnership now, as it was not in 2022 at the last EU-Africa Summit, for the next one, we are not going to have an impact.
Thank you.
So.
Okay, so.
Yeah. I totally agree with all comments made, even the last comment. Let me tell you our frustration. African countries were colonized by European countries. It means we have a strong linkage, Africa and Europe. But what we see, Europe doesn't listen from us. We want to see Europe coming and saying, talk to us, tell us what are your needs and where we can support for you to move forward. We don't want to listen every day about blames, about risk, about things like that. Today, what is the truth? I will tell you. When we are talking about the resistance, I don't know, maybe you didn't say it clearly. Yesterday I was informed that there is a resistance to organize the EU-AU summit next year. Why there is this resistance? Donald Kaberuka was saying there is a big elephant in the room like China. Our leaders, they flew to China in September with a commitment of $51 billion over the 3 years. We want Europe to change the narrative. Our leaders, they are tired to come just to talk. We talk, and nothing is done. Let us, in the health sector, I don't want to talk as a politician, in the health sector, we are leading that sector in Africa. We know what we want. We have our plans. Countries have plans. Can we please sit and see how we can work to achieve these plans? We are talking about universal coverage, primary health care, and we have clear idea where we are going. When I'm discussing with my ministers and my leaders in Africa, the impression they are giving me, it's like Europe, they know what we want, and they are coming to give us what they want to give us. And this is so frustrating. The last one I wanted to talk about is we can improve on the way to work together. This is what President Macky Sall was talking about, the New Deal. And for me, this New Deal is so important. When we are talking about the health sector in Africa, there are countries doing very well. Let me talk about Rwanda. This country, out of $145 million they need to stop Marburg, they already provide around 60 million. How much Europe gave to Rwanda?
Can I ask you though?
Mm-hmm.
I'm going to be provocative. Why should anybody give any money to Rwanda to deal with its own health problems?
Why no one is giving money to Rwanda?
No, why should anybody give money to Rwanda to deal with its own health problems?
No, we cannot take it from there. We have to say that we are living in one planet. And let us learn from COVID. What you are telling me is exactly what people were saying when COVID started in China.
This is why I'm telling you.
People, they were saying, why do we have to support? Let us even lock China, and this COVID will stay there. Today, Rwanda did great job. Believe me, I went to Rwanda 4 times since this Marburg outbreak started. This is the first time to see a country dealing efficiently with an outbreak in Africa. If Rwanda didn't manage this outbreak, maybe we will not sit today here. But this country did a lot with the resources that they have. Now they need solidarity. You know what we are getting from other countries? Travel ban. But this travel ban will not save you. I think it's time for European leaders who are here to talk to their countries. You were minister. Please talk to Portugal. And we need now to say, this country, we are talking, because we don't want to talk about countries where there is no transparency. In Rwanda, there is transparency on the way to manage resources. I think today, if we can put money in the Rwandan system, it will bring impact and will save the world. My voice today, my pledge today, my advocacy is, let us support this country that has a clear plan, that is providing funding, but they don't have enough money, that will save also our life in Africa and in the world.
Thank you. You've been shaking your head actively, Dr. Temido, so please go ahead.
Well, I fully disagree in so many things that you mentioned. And this is very good, because it's very different from normal situations that we have on that type of conferences, usually we say, I fully agree and I fully support, but I fully disagree. Why? Because if we want to build a real partnership between equals, we also need you to understand our problems. And we also have huge problems. Europe is under a recession, a financial recession. My country, my own country, is a small country. It has been under financial assistance a couple of years ago. So we are fully committed in partnerships, namely in public health partnerships, because we learn from the past what this nobody's safe till everybody's safe means. But for those types of partnership that we need to build on, we need trust, and the trust comes with truth. And truth is that partnerships is not only giving money. We don't have money even for our own healthcare systems most of the times. Politics is an issue, and coming to your question, of all of us. We all have a role to play in our healthcare and in politics. So, and today we have something very different happening in the world, and this comes from United States of America. And I think that the most important challenge that we need to keep today is that we need to be responsible for our decisions and assume the difficult times we are living in. As a European, I would like to see more funding from Europe for healthcare in Europe and abroad. I would like to see a common policy regarding human healthcare resources, human health resources. That is the huge, is another elephant in the room that nobody is carrying. We, in Europe, for instance, we risk to have beautiful infrastructures, beautiful health programs, and no workforce for health. And I know that we are brain draining human resources for health from other countries, and this is unfair trade, at least. But we need to discuss how we can cooperate under what we have, and not on promises that that are not more than words. And we all face difficulties, and assuming our own responsibilities and not giving up of delivering and not ceding to skepticism or unfaith is my point of dealing with it during the pandemic in a poor country as Portugal.
Thank you. Please go ahead, Mr. Brems, and then I will try to wrap up the nuggets I am seeing emerging here.
What can I add? I can reply to, we have programs already where we are training people in Africa, which are then going to the European market. We should do more on circular migration. There is a lot of opportunities, but we don't always agree in Europe either on fundamental issues. We want to defend more spending on health in Africa. And we are like-minded in the European Council, but there are other countries who are not. We have to face this reality that we're not united on everything in Europe. And we are always dealing with compromises in trying to get a part of what we want. So it's not always the one Europe. There are allies, and perhaps we should link up with the allies and trying to get the support to convince the ones who are not fully in agreement with what we want. For the next MFF, of course, I would have liked much more, even in the previous one, which I discussed, by the way, to have much more on human development and on health and on education, etc. And then when we had a nice agreement, and I've personally, and some will know it in the room, I've personally put in the at least so much for sub-Saharan Africa, and this is what is protecting now part of the budget to still go to sub-Saharan Africa. And we have to be careful to what we discuss for the next MFF. And we need this alliance, but we are in a minority on these issues. I must admit that it will be a difficult discussion. Let's be honest in our partnership and say the truth. As you say, we are not always on the same line with all European countries, and you should link up with the ones that you want to support. We tried it with our presidency, and I don't want to put myself in flowers, but we have done, I guess, some steps towards this partnership in health, in trying to move, but it's not enough, and it's never enough.
Thank you. I have a big red light blinking at me from the back of the room telling me my time is out. So I am going to stop. But before I do, allow me just to maybe crystallize what I have heard, and if I paraphrase you, forgive me. I think what we're saying here is mature relationships are ones in which you can have discussions and be honest without breaking up, right? They don't need to be slamming of doors and I'm never talking to you again. And so that mature relationship requires both Africa and Europe to bring all of the nuances from both continents to the table. What is working, what is not, what the difficult areas in the relationship are internally and externally. I'm caused to reflect that Europe has a global gateway program and a global gateway. Does Africa have a Europe program, a Europe plan in respect of health? Perhaps that is something that the Africa CDC could take the lead in articulating to help have that conversation where all the issues and all the problems are brought to the table. There's a proposition for circular migration. I would say that circular migration is happening. We talk about the stuff that ends up with dead bodies in the Mediterranean, but we don't talk about the agreements that are being concluded to bring hundreds of thousands of Africans to Europe. And what could be leveraged from those. Each country has them, you will know. And so the human resources for health, whether those are community health workers or others, can be leveraged to the benefit of both continents. I think at our shortest point between the two continents, it's something like 20 kilometers, not even, something like that. So we are closer than any other continents are. And politically, we are probably closer because of historical and also geographical reasons. Let's leverage that to make both our continents resilient. We share common languages. Let's leverage those to our mutual benefit. I thank you all for your attention, and I hope there'll be more discussion in the break.